I have cancer.
I have cancer.
I have cancer.
I have cancer.
I have
cancer.
cancer.
I have cancer.
I wish eliminating cancer was as easy as drawing a line through the word, but we all know that's not the case. Children's cancers can be especially challenging. Here at the Kimmel Cancer Center at Johns Hopkins, we're working very hard to make big changes in the way we treat children with cancer. I'm Don Small, the director of the Pediatric Oncology Division. What happens to normal cells to cause cancer? It begins with our DNA. These 4 molecules are the building blocks that make up our genetic material. Together, in different combinations, they make us the individuals we are. They make up our genes. But mistakes happen. We call this mutation when our DNA gets altered. These mutations can cause cancer. The good news is many cancers in kids can be cured. And for those who cannot, we're working actively on a cure. That's not a word we use very often with this disease. Kids also benefit from our clinical trials and helping to improve the cure rate for future children with cancer. We have an amazing team of researchers and clinicians here at Hopkins dedicated to breaking the code to children's cancers. We're confident this will lead to better treatments and higher cure rates. Meet our team of experts.
Kids with brain and spinal cord cancers fall to the back of the pack when the time comes for testing new therapies. These cancers are stubborn and frequently don't respond to standard chemotherapies or radiation. I'm Ken Cohen, director of the Pediatric Neuro-Oncology program at the Kimmel Cancer Center at Johns Hopkins, and I'm also clinical director of the Pediatric Oncology program. Treating children's cancer is complex and challenging. That's why I'm here. We've got some of the best researchers working on discoveries to better treat kids with brain and spinal cord cancers. I'm able to take those results from the lab and put them to work for my patients.
The only days you had the bone pain were right after the Neulasta? Right.
Time is always a factor in treating kids with complex brain and spinal cancers. I'm working to speed up the clinical trials process involving pediatric oncology therapies.
We've got to try and do what we can to stimulate the greatest movement of those cells out in the most coordinated time. So we want that to happen.
Many childhood cancers are medical mysteries and require unique or novel treatments.
One full pill, which made him totally wacky, and the next 2 times just half a pill.
Okay, yeah, and you got to sort of, again, we got to dose find a little bit for all this stuff. So
that's why the current focus is to develop different mechanisms of delivering these treatments to the brain, as well as discovering new agents. Here at Johns Hopkins, one of the things we're studying is how certain switches in the brain turn on tumor suppressor genes. These are genes that put the brakes on fast-growing cancer cells.
Put your tongue up to the top of your mouth. So no sores.
The challenges are many for children and adolescents with cancer. The fact is, it's the leading cause of disease-related death amongst children. We've made a lot of progress saving these kids, and I'm encouraged by the gains we're making in the lab. I'd like to see them progress to the treatment phase a lot quicker, but that requires a lot of intense resources. Our dedicated team of clinicians, researchers, and nurses are leading the way to better care for all children with cancer, but we need your help too. I'm Ken Cohen, Director of Pediatric Neuro-Oncology and Clinical Director of Pediatric Oncology at the Kimmel Cancer Center at Johns Hopkins.
I'm David Loeb, and I'm the Director of the Pediatric Oncology Musculoskeletal Tumor Program at the Kimmel Cancer Center at Johns Hopkins. It's my turn now?
It is your turn. I am done.
I work with kids who have been diagnosed with sarcoma, which is a tumor found in the bone or in muscles or tendons.
I think my heart rate has been high, kind of.
These are very tough cancers to treat in kids because even with treatment, they often relapse. That's why I'm hoping my lab work will one day change the way we treat sarcoma in children. The main focus of my research involves identifying stem cells within certain kinds of childhood bone tumors. Ewing sarcoma stem cells, a rare population of cells, often elude anti-cancer drugs and drive the growth and spread of tumors. In my lab, we're working on identifying and targeting these specific stem cells. We can do that kind of work now thanks to new sophisticated technologies, and this will ultimately turn the treatment course for these difficult childhood tumors from the big chemotherapies and move them towards targeted therapies. Early results are promising, and our team is working quickly to bring new treatments to our young patients based on this research. I'm David Loeb, Director of the Pediatric Oncology Musculoskeletal Tumor Program at the Kimmel Cancer Center at Johns Hopkins.
Watching the research that I do in the lab translate into clinical trials, then translate into long-term survival for many childhood cancer patients, tells me every day I made the right choice in becoming a pediatric oncologist at the Kimmel Cancer Center here at Johns Hopkins. I'm Heather Simons. Do you know the most common form of childhood blood cancer is leukemia? This is a cancer that starts in the bone marrow where new blood cells are made. In many instances, we need to treat our young cancer patients with a bone marrow transplant. This can actually cure the disease.
All set.
If that sounds easy enough, it isn't, because we often have trouble finding an exact bone marrow match, even when we test close relatives like siblings or look for an unrelated match donor. An exact match is often not found. But here at Hopkins, our team has discovered a new way to deliver bone marrow transplants. Do you feel dry inside your mouth? Like your tongue is dry, or?
Yes.
Yeah?
A little at the moment.
Okay. Now, many more childhood leukemia patients are able to receive this curative treatment. We use half-match donors rather than a full match, and still give patients the effective treatment they need. We call this a haploidentical transplant, and it has revolutionized bone marrow transplantation. It has been a particular challenge to find a fully matched donor in the national and international registries for patients of African American descent and other minorities, putting these patients at an increased risk of not being able to get a bone marrow transplant. Finding a half match is much easier since most children have a half match parent or sibling. Half match donors make it possible to treat many more patients with childhood blood cancers. This therapy is saving lives.
I mean, it's winter.
Yeah.
Skin's just dry.
Did you have this before transplant?
What? A little bit, but not to the same
Not as much.
extent.
Yeah. And it doesn't stop there. Half-match bone marrow transplants are being used in earlier stages of leukemia and other blood cancers, and we're exploring its use for children with solid tumor cancers and non-malignant blood disorders like sickle cell disease. I'm Heather Simons, a childhood cancer oncologist at the Kimmel Cancer Center at Johns Hopkins.
I knew medicine was my calling, but I really didn't know what my specialty would be until my third year of med school when I was assigned to a pediatric oncology rotation. My life changed that day. It was one of the strongest gut feelings I've ever had. I met these amazing kids fighting for their lives with a maturity way beyond their years. I wanted to help. I hoped I could help. That was 15 years ago. I'm Pat Brown, and I'm the director of the Pediatric Leukemia Program here at the Kimmel Cancer Center at Johns Hopkins. My primary area of expertise is leukemia, or blood cancer, which is the most common form of cancer in kids. Jackson, how's it going? Like all of the doctors at Johns Hopkins, I'm a physician, a researcher, and a teacher. I am very lucky to lead a dedicated and talented team of lab researchers trying to develop new and improved treatments for children with leukemia. Cancer is so tough to conquer because every cancer cell is driven by changes or mutations in several different genes. These mutations are what causes this deadly and destructive disease. Our challenge, our quest, is to find a combination of drugs that target these mutations to kill the cancer cells but leave the normal cells unharmed. The Children's Oncology Group, an international network of researchers and hospitals, has appointed me to lead the first clinical trial testing a new treatment that includes a novel drug developed in our laboratory. This drug targets mutations in a gene called FLT3, an important cause of blood cancer. By focusing on therapies that specifically target cancer cells, we are hopeful that this new treatment will not only cure more patients, but will do so with fewer of the side effects commonly seen with chemotherapy. In the Children's Oncology Group network, over 90% of leukemia patients are treated through the clinical trial process. These trials are the only way to know if a new treatment will actually cure more patients. A treatment that is successful in a trial then becomes the standard treatment for kids suffering with cancer. Over the last few decades, these clinical trials have changed leukemia from a disease that killed 100% of patients within a few weeks to one where most kids are cured. That is pretty amazing. I feel privileged to play a role in this process and incredibly grateful for the courage our patients and their families show when they agree to participate in these trials. And you said Dad's feeling okay?
Yeah, Dad's feeling good.
Well, he should be very proud of himself for donating bone marrow for his boy.
Yeah.
Treating children with leukemia is a tremendous responsibility that I do not take lightly. While we work to develop new and better approaches to treatment, we do everything in our power to protect every patient and offer only treatments that we believe in our hearts will help. These amazing kids deserve nothing less. I'm Pat Brown, Director of the Pediatric Leukemia Program here at the Kimmel Cancer Center at Johns Hopkins.